When I was pregnant with my first child, Catherine, ProPublica and NPR published a series of stories on maternal health. That is the health of mothers during conception, pregnancy, childbirth, and postpartum. It's the 21st century, and this is a first world nation. So as an optimistic, soon-to-be mommy, I was absolutely freaked out by the statistics and stories published in these articles. Yet, as a Black woman living in the US and one who studies equity in health and community contexts, sadly, I was not surprised. In the category of maternal health, the U.S. ranks, wait for it, last among industrialized countries with over 650 documented maternal deaths in 2018. We can all agree it is heartbreaking to mourn the loss of a mother while celebrating the birth of a baby. Yet, it is not enough to consider the totality of this tragedy. When we look at maternal health through the lens of equity, we must ask, is one group experiencing challenges more than others, and why? The stories, the data offer overwhelming evidence that this loss of life is not equally shared among all women and their families. The maternal death ratio for Black women is 2.5 times that of white women. And this is nothing new. Black mothers have been more likely to die than white mothers for more than 100 years. And it's not just death during childbirth, which can be caused by hemorrhage or severe bleeding. Maternal mortality also considers deaths up to 1 year after pregnancy. Then cardiac and mental health conditions are identified as leading causes. Here's the thing. The Center for Disease Control reports that 3 in 5 pregnancy-related deaths are preventable. Given this truth, why are so many Black women dying from bringing life into this world? What we know for sure is that education is not a protective factor. A Black mother with a college education is at 60% greater risk for a maternal death than a white or Hispanic woman with less than a high school education. And while income is also not a protective factor for Black women, it is a contributing factor. Medicaid, the publicly funded health insurance program in the U.S., pays for nearly 50% of all births in this country. And 60 days following childbirth, coverage ceases, which leaves women who earn a lower income with limited access to medical care when they need it. To be clear, it is not just about accessing medical providers, services, and in many cases, specialists. Quality of care matters. In the Giving Voice to Mothers study, 1 in 6 women reported maternal mistreatment, such as being shouted at or threatened. Black women were twice as likely than white women to report that a provider ignored them or refused their request for help in a timely manner. For Black women, every experience is racialized and gendered. This does not exclude interactions with physicians, nurses, and midwives. Bias, implicit or explicit, microaggressions, questions or actions that reinforce negative stereotypes, make Black women feel disrespected, unheard, and even silenced. How can such inhumane treatment persist when Black women are literally gifting humanity? And what changes must happen in order to ensure that Black women not simply survive, but thrive during their maternal health journey? Maternal health is what we call a complex multifactorial issue. You cannot pinpoint or isolate a single factor. Therefore, it requires an integrated approach to change in terms of policies at the national and local levels and practices in clinical settings and community spaces. Recently, the Black Mamas Matter organization kicked off Black Maternal Health Week with discussions of how culture, community, and technology can increase the health and wellness of Black women throughout their entire maternal health journey. That is conception, pregnancy, childbirth, and a year into a Black mamahood. Here are a few for us, by us solutions that address Black maternal health challenges, consider the multiple intersectionalities of Black women and people, and showcase innovative approaches to social change. Commonsense Childbirth is a nonprofit with over 2 decades of inspiring change in the maternal health care system through community-based maternity centers and by training and engaging the perinatal workforce of physicians, doulas, midwives, and other community workers committed to eliminating disparities in maternal health. BirthWorks seeks to connect Black mothers to Black birth workers and healthcare professionals via online courses as a tech-enabled strategy to combat the barriers that cause Black maternal health and breastfeeding disparities. Natal, a podcast and docuseries about having a baby while Black in the United States, amplifies the voices of Black parents by giving them a platform to tell their story in their own words about bringing new life into this world. And finally, Earth. That's birth without the B because they dropped the B for bias. This Yelp-like platform is where Black and brown women and birthing people can find peer reviews for prenatal, birthing, postpartum, and pediatric care. Then Earth turns those collective experiences into meaningful data to end racism, sexism, and bias in our maternity healthcare system. These for us, by us social and technological innovations emerged from a community of Black women asking, why are we experiencing maternal health challenges more than others, and how can we change a system to ensure that we thrive? As Black women build and share resources, they change circumstances for themselves and others, build community locally and globally, which is yet another gift for humanity. My name is Dr. Erica Tate. I am the founder of Bluknowledge and a Black Mama. Thank you for tuning in to our perspectives on equity.